I would like to talk on Bangladesh's existing health sector developments, achievements, problems, and the future program for the next 5 years in view of the requirements and developments in the SDGs. I will mention two major developments in health. Number one is the huge rise in life expectancy in Bangladesh from a very low 61, 62 years in 1970 to 72 years now, with women living longer than that. That's one achievement. Another is, I will mention just one more, which is the decline in total fertility rate from a high of about 6 to 2.3 now. So keeping those two in mind, I will also mention some of the other achievements in relation to the MDGs. By 2015, some of the major health indicators in MDGs were achieved by Bangladesh. Contraceptive prevalence rate moved up from 49 to 62, reducing infant mortality rate and under 5 mortality rate, which was MDG 4, was recognized internationally, and the Prime Minister was awarded international awards on the basis of those achievements. Bangladesh's maternal mortality ratio also sharply fell from 472 in 1991 to 194 in 2010. However, the recent survey of maternal mortality shows that it has plateaued at around 196. And the nutritional situation, which was MDG 1, in spite of the overall higher rate of nutrition, both the indicators of nutrition, both stunting and underweight, Bangladesh achieved the MDG targets. The stunting rate fell from 51 to 36, and the underweight rate fell from 43 to 33. The other MDGs, 6, HIV/AIDS, malaria, and TB, Bangladesh was on track in achieving HIV and in reducing death from malaria and other indicators of malaria. As for TB, the cure rate was 90%, but Bangladesh needs to pay more attention to its prevalence, death, and detection rate of TB. So broadly, the Bangladesh achievement in improving various service-related results during the MDG period, that was very impressive. Now, over this period, this is a dynamic situation where things are moving very quickly. And Bangladesh's, both the demographic changes are taking place. People are moving from the rural areas to the urban areas. And the incidence of diseases, those patterns are changing. And we are moving from more and more from communicable diseases to non-communicable disease, to a situation where the NCDs constitute the major cause of death in Bangladesh. The other part is that there are socioeconomic changes that are taking place. People's income are rising. There is a rising tide of expectations of the people, and there is a change in options to choose. So people are choosing quality and paying for it. The women's education, empowerment are important factors. Channels of communication has improved, so people know where the options are, where the services are, and the infrastructure developments are taking place. At the same time, the private sector has expanded both in medical education as well as in technical manpower, producing technical manpower. So this is a challenge to the public sector's stewardship role. And we have now a situation where the out-of-pocket expenditure have been rising in Bangladesh. And now it's about 67% of the total expense in health is being met by the people from their pocket, And government's share in the total health expenditure has fallen from 37% to 23%. So these are the new situation where the SDGs we are embarking upon the SDGs. The challenges that remain to be faced in Bangladesh, in spite of the achievements, are that maternal mortality ratio needs to fall, and other areas where we have to improve our performances are neonatal mortality rate, the contraceptive prevalence rate, and the total fertility rate. As for the services, there is an unmet need for family planning which needs to be handled. The contraceptive use has to improve, ANC and PNC coverage has to improve, and the infant child feeding practices have to expand. So these are the challenges, and keeping these challenges in view, Bangladesh government has adopted a next 5-year plan, which is the 4th sector plan in Bangladesh. The reasons for adopting the plan are that there is a need for consolidating the gains which have been already made. There are challenges of the changing scenario from rural to urban areas, from CDCs to NCDCs, and there are national aspirations as well as the international commitments. So that is the background under which the new 5-year program has been. The main objective of the program, which is supposed to last from January 17 to 2022, the main objective is to increase access to quality healthcare and improvement in equity and efficiency.